All right. Well, welcome everyone to our RICMAR webinar. We are very excited to have you all with us this morning. My name is Lourdes Guerrero. I am the MPI of the RICMAR Coordinating Center at UCLA. With us today, we have Dr. Nadi Parat, who is our other MPI of the Coordinating Center, and two distinguished speakers, Dr. Helen Lamont and Dr. Amanda Cash, who will be talking with us today about opportunities in the federal government for researchers, particularly aging researchers. Dr. Lamont is the director of the Division of Disability and Aging Policy in the Office of the Assistant Secretary for Planning and Evaluation. And Dr. Amanda Cash is the director of the Office of Performance and Evaluation in the Center for Policy and Evaluation of the Administration for Community Living, ACL. So without further ado, I'll let them introduce themselves a little bit more to you all and to get started with our presentations. Take it away.
Great. Thank you so much, Lourdes, for the introduction. It's so fabulous to be here today. I first heard about the RICMAR program at our July Advisory Council meeting on Alzheimer's research, care, and services, where we heard from Dr. Arush about research on Arab Americans and Latino Americans in Michigan. And then we also heard about work from Dr. Fabius on work, in the direct care workforce in Maryland through Johns Hopkins University. And I thought to myself, what a great opportunity and network of people who have interest in aging and aging issues that are relevant to the policy work that we do. And then selfishly, I thought, gosh, we really need to build up our aging expertise in federal policy. And so I reached out to Melissa Gerald to put me in touch with Lourdes and set up this presentation. So I'm so excited to be here today to talk to you all about the work that we do. And then I guess selfishly, on the other hand, I should also mention that when I was a graduate student, I was pretty sure that I didn't want to go into academia. And it would have been great for me to hear a presentation on these sorts of policy jobs that exist that use the skills that folks develop in graduate school or even in undergraduate sometimes that are very, very valuable. And so I thought it'd be a great opportunity to reach you all and to help you spread the word to other faculty members or to students about our opportunities. So I'm going to share my screen and hopefully not mess it up. One second, let me put you guys at the top. So a little bit about me. When I was in graduate school, we used to always start with, how did you get into aging? So I was a rare undergraduate who, well, not so rare in that I started pre-med and then decided, oh no, I don't want to be pre-med anymore. I want to do psychology. And I happened to work in the Center on Aging at Duke, which actually had the chair of the Gerontological Society of America at that time. And around junior year, I heard a presentation on aging and the demography of aging and thought I need to work in this area. So when I finished my undergraduate degree, I immediately applied to graduate programs and pursued a Ph.D. in aging studies from USF in Tampa, and did both policy work and then more methodology work. My dissertation, now I laugh because it was focused on what we now call SDOH. And SDOH is a cause of racial and ethnic disparities in the health and well-being of older adults in Florida. But back then we talked about it as community context, and we looked at individual characteristics and the additional impact of community characteristics on the well-being of these older adults. And after I finished my dissertation, I had the opportunity to do an internship with the EPA Aging Initiative, which was like a one-woman shop at the EPA. And she put out all this information on older adults and in the environment, and the way that the environment affects the health of older adults. And it was such a great opportunity to be in DC. During the summer wasn't great, but it's a great time to be in DC because there's so much happening. I got to go to meetings, and I called my now husband and said, I want to work in DC. I want to influence federal policy. I was connected through my graduate program to some folks that work in ASPE, and I'll describe ASPE in a few minutes, and sort of hit it off and got a job there and have worked there ever since. About a year and a half ago, I was promoted to the director of the Division of Disability and Aging Policy. Much of my work is on dementia, although I did not do any work on dementia in graduate school. I thought, oh, enough people work on dementia. But this photo is from a guest lecture I gave back at USF in 2015 on our federal national plan to address Alzheimer's disease. And it felt like coming full circle and coming back to see people who did work on dementia and all the great dementia resources we had at USF. So this is me with Dr. Brent Small and Dr. Kathy Heyer, who some of you might know is no longer with us. This is ASPE's mission statement. I just put it in here so you can refer to it. We don't need to go through it, but I'm going to describe what ASPE is here and a little easier in bullets. So HHS includes, if you didn't know, these big operating divisions: CMS, FDA, all of NIH, HRSA, which is the Health Resources and Services Administration, the Administration for Community Living, where Amanda's from, and many other organizations like that. Big, big operating divisions that touch every American. So the Office of the Secretary, or we call it OS, sort of oversees all of those operating divisions. And that's where ASPE sits, or the Office of the Assistant Secretary for Planning and Evaluation. So we get to work across all of those agencies to coordinate and provide a cross-cutting perspective on the topics that we work on. So we conduct policy analysis across all those HHS agencies, and sometimes we work outside of HHS as well. We conduct policy research on targeted areas. We respond to emerging policy issues or topics. And in order to do that, we sort of have to be a step ahead of the game and have an eye on what's coming in different policy areas so that we can be responsive. We contribute to cross-cutting initiatives, or sometimes very focused initiatives that may or may not fit in one of the agencies or that need that across HHS perspective. We conduct strategic planning both for all of HHS. So the HHS strategic plan is done out of ASPE, but then, as I mentioned, the National Alzheimer's Plan is a strategic plan on a specific content area, and we coordinate that as well. We coordinate on the legislative policy proposal process, which is a way that the administration proposes policy changes that require legislation. And we serve as sort of the policy analysis lead for that. And then I would be remiss if I didn't mention that we are the home of the Secretary's chief economists. So we're not the only group that does policy analysis in HHS. We do fund research, but it's a very, very, very tiny amount of research relative to many of the other organizations. And we're also not an advocacy organization, but we do all of those other things. We are physically located. This is a beautiful picture of our brutalist style building, if you will, in DC, pretty close. I couldn't find an image with us relative to the Capitol, but we are essentially on the mall level, one street away from the National Mall, very close to the Capitol. The House buildings are very close to us as well. So we're really in the seat of policy making in Washington, DC. We also are still in a hybrid posture, so much of our work is done on Microsoft Teams and Zoom. But if you want sort of the real DC experience, we get that experience physically when we're at work. We have about 140 staff, and if you think about all of the things that HHS does, it's small but mighty, right? Every single topic that HHS works on, from healthcare policy to TANF to other income support programs to aging, et cetera, to drug development and approval, all of those topics are covered by at least one person in ASPE. Everyone has a variety of training and expertise. Many folks that work at ASPE are social science analysts, but not exclusively. We also obviously have economists, we have doctors and nurses, we have some urban planners, social workers, et cetera. And I would say, Amanda could correct me if I'm wrong, I would say maybe a third of our organization is folks with PhDs, but not everyone. A lot of people have master's degrees and there's no sort of expectation that folks have a PhD in order to work in ASPE. And we're a relatively flat organization in that the staff are valued and recognized even from early on. So it's not like you start as a very, very junior person who's only, kept in their office to do sort of supportive work. Most analysts in ASPE are empowered to work on their topic and are seen as a leader in that topic pretty early on in their career. So ASPE is organized. This is our org chart. I'm sorry, I couldn't find one that was bigger. We have 4 policy offices. Our office is the Office of Behavioral Health, Disability, and Aging Policy. We cover those topics. We are the policy office that's maybe the most cross-cutting in terms of populations. And so we work with CMS on Medicare policy and Medicaid policy, of course. We work with SAMHSA on behavioral health, but behavioral health is also paid for in many ways by Medicaid and Medicare. So we are also working with CMS. Long-term care is a big part of our portfolio and used to be in our title as well, but that's still a big part of what we do. Our Office of Health Policy covers healthcare financing, big Medicare and Medicaid policies that are coming out, public health and public health services, healthcare coverage and access. This is the office where the numbers of, well, they didn't come out when it happened, but when the ACA was first implemented, the folks in that office were running the numbers for the ACA enrollment at the very, very beginning. And then looking at healthcare quality and outcomes. Our Office of Human Services Policy, we think of them as sort of covering the other end of the age spectrum in some ways from our BHDAP office. They look at family and youth policy, and they're where TANF is covered. They do things like the annual poverty guidelines. They set those numbers, and then they work on child care policy, youth policy, et cetera. And then finally, our Office of Science and Data Policy. Amanda used to be in the Office of Science and Data Policy, so we've worked pretty closely together, which looks at science and data policy across HHS. They're also the lead for the CDC portfolio in public health, and then they work on the FDA portfolio, and they set sort of the agenda for data across the entire HHS organization. And they also have the Division of Strategic Planning that leads, as I mentioned, the HHS Strategic Plan. So lots of details here, all of that to say mostly that if you are interested in any of these topics and they don't necessarily fall under the topics I'm going to talk about today, but they're related to something HHS does, there are other folks in ASPE that we'd be happy to connect you with. And I should also mention ASPE is a pretty political organization. So our assistant secretary, so there's a person who is the assistant secretary for planning and evaluation, that's a Senate confirmed position. And then supporting that person is another appointed position that we call the principal deputy assistant secretary. And then 3 of our 4 policy offices have political appointees serving in them. So what does this mean for our work? It means that generally every 4 years or less, we have a change in leadership in ASPE. It can be a good thing or it can be a bad thing. It sort of depends on the individuals, not actually on the administration. And in BHDAP, we're pretty lucky because our topics are bipartisan. So we don't generally see a big change in the priority areas in behavioral health or aging or long-term care policy with a different administration, which makes it easier to weather all of those many changes. So I thought, I'm talking to a group of primarily academic researchers. It'd be helpful for you all to know what policy research is. So with policy research, we're trying to understand how policies, regulations, and practices influence the health and well-being of our target populations. And so it requires a different type of research question and a variety of methodologies. A policy is not going to be, thinking back to my dissertation, I remember coming to ASPE and I was asked in my interview, okay, you've done all this work on SDOH and health disparities, like what's the policy lever that you're going to flip to change this and to make it better? And I couldn't answer that question. So one tip is that if you ever apply for a job and you can't answer a question, you might still get it. But the reason you can't answer that question is because in order to address those inequities in SDOH that lead to those health disparities, there are millions of policy levers that need to be changed. And so that's the change in thinking that has happened while I've been at ASPE, and sort of the skill that we need to learn is what are the discrete policies that could be changed or could be informed by our research in a way that is more equitable, that meets the needs of our populations. So we do quantitative research, we do qualitative research more often than I probably ever thought we would. And we often do mixed methods. So we might do an environmental scan to say how many states are implementing the policy this way, or a literature review to summarize what do we know on this topic. And that will include, of course, peer-reviewed literature, but often gray literature. We often bring together focus groups or folks with key expertise to tell us what they're doing and what innovations they're hearing about and what the barriers are to those innovations, trying, of course, to elicit policy barriers. We develop study designs. Some big program evaluations have been done out of our office. We analyze administrative data like Medicare claims and the TAMSIS data. And we often, in our office in particular, link and analyze data sets together, such as the HRS and Medicare data, to get the full picture of something that's happening. And this work is done at various points in the policy process, excuse me. So we start early on, like what is the data infrastructure that we need in order to be able to answer policy questions? And a great example of that right now is that we have actually very rich data on disability among older adults, thanks to some of our very large epidemiological studies funded by NIA. We actually don't have that data infrastructure on disability among working age adults. And so we're working on a project now to sort of build that data infrastructure. So we need to build the data infrastructure to answer the policy questions. We need to know what's happening in the field. So as policy questions arise, we're able to answer them. As policies are being crafted, looking at alternatives, and when alternatives have been tested, what evidence do we have on those? Evaluating policies that are implemented, of course, and then continuing to review the quality process throughout. So depending on where the policy topic is, we might do many, many different types of policy research. How do we do this policy research? So you're thinking, oh gosh, this seems like a lot for these folks to do. So we do some intramurally using a variety of data resources. I will let everyone down when I let you know that we don't just have carte blanche access to CMS claims data. Unfortunately, we still have to go through a DUA process. We still have to actually pay to get access to those data, but we have other data resources and we can access the CMS administrative data to do those intramural analyses. And a lot of our research is done through contracts. So how would I describe like a contracted research project, and how would I have described it to myself as a graduate student? So I think of it now as the best part of doing a research project, although people will disagree with me. So we come up with the research questions and the topic area. We can specify data sources and the analyses that we want done. We write a statement of work, and it can sometimes be very, very, very specific. And then we have that done by a contractor with a lot of input from us throughout the process. So then the contractor goes and does the work and comes back to us with deliverables that we review, provide input on, disseminate, et cetera. So what this does is gives us a great opportunity to work on a variety of topics, to set up the idea to make sure that it's being done the way that we want, in contrast to a grant where there's a lot more flexibility for the grantee. We specify exactly what we want, and then we get the results back and, of course, like share. Our contractors take credit for the work that they've done, and we take credit for the work that we've done on it. And our goal is to advance the policy issue that the project has addressed. And I wanted to mention, I was hoping that we could get someone to join today, but I was unable to do that, that in addition to sort of the federal career opportunities that we have, that we're presenting about here, there are these contractors such as RAND, NORC, RTI, Mathematica, et cetera, that do this research. And for them, this aging expertise and this methodology expertise is really important. So if you're interested in working in this area, those are also great places where you could find a job. They pay generally better than the federal government does. And so if that's an area that you're interested in pursuing, I would encourage you to look to all of them for job opportunities as well. So a typical day at ASPE, we do a variety of things, right? I listed all the things that ASPE does, and I didn't mention there, though, that sometimes we do them all on the same day. So you might be reviewing deliverables, meeting with an agency partner on a cross-cutting initiative. You might have a report to review through the clearance process where we're making sure that it's consistent with administration policy. Go ahead, Amanda.
Just a time check. It's 12:25.
Okay, I'm gonna go fast then. We respond to leadership requests, which sometimes we call fires. There's something quick that we need to respond to. We're going to meet with ASPE colleagues, and then we're always sort of looking to the future for backgrounds for a future research idea, or making sure that we're up to date on what's happening in a specific area. Yes, I forget what I was going to say there. All right, so our office, behavioral health, disability, and aging policy, as I mentioned, focuses on those populations. We work with the agencies that I've listed here on this array of topics. This is not an exhaustive list, but this is a list of many of the topics that are in aging and long-term care and behavioral health that we are actively engaged in work on. And if we're not actively engaged in work on it, we're keeping tabs on what's happening so that we can be helpful to our agency partners and to the secretary and his office as they make policy decisions. So I thought I would brag about some ASPE, or excuse me, BHDAP research that we've done in the past. So you may know about consumer direction. So the cash and counseling demo was done out of our office. We've done work on the residential, building data infrastructure through the residential care facility survey, the National Nursing Assistant and Home Health Aid Survey. We've done work on falls prevention. We've done work to evaluate the supportive, I forget what SASH stands for, but senior services and at home, and how they can support older adults and slow their Medicare spending. We've looked, of course, extensively at COVID and the impact that COVID had on people with dementia, on staffing in nursing homes, on the demand for and the staffing of home health care agencies. And then we've done some work on the risks and costs of long-term care. We were also heavily involved with the CLASS Act, which was a long-term care insurance benefit that was in the Affordable Care Act. And we were doing all the modeling to figure out how to make that work. Ultimately, we were not able to find a way that financially it would work out. But our office was tapped to do that work and to work closely with the secretary to see if we can make that feasible. And that was an exciting time, of course. These are some of the interagency initiatives supported by BHDAP. I don't want to go into them too much, but I know we have a lot of folks interested in Alzheimer's disease. And so that's something that I personally am very engaged on. We call it NAPA. So we have an advisory council, or the NAPA-FACA, and then we have a national plan to address Alzheimer's disease. And that's been a great area to build coordination across the federal government on aging, long-term care, all of the things that are assisting people with Alzheimer's disease and related dementias, which is sort of everything in the health and long-term care system. And we recently added a goal focused on risk reduction and healthy aging as a way to sort of move the federal government forward on those topics, both for people with dementia, but because it's focused on reducing your risk, everybody, all adults actually, and all older adults. So what are we looking for? We're looking for folks who are interested in all, of course, of our topics. We would love to have some more intramural research capacity and expertise in survey and administrative data sources. The folks that do the best in ASPE are those who are curious and analytical. Sometimes we're called like the skunk at the picnic, because we're the folks that raise our hand and say, oh, have you thought about this? Have you thought about that? But really with the goal of making what our federal partners do better. You have to be dedicated to public service insofar as, you're not getting credit for the work that you do often as an individual, but your office might get credit, or the administration might get credit. And that is absolutely fine for some people and not for others. Independently motivated, as I mentioned, curious. There's a lot of our job that is, you have extreme autonomy. Anything that you want to work on that's in your area, you are given that freedom to do, but you need to be a person that's going to take initiative on those. I wrote connections, and I think I had somebody review these slides and they were like, oh yes, connections between people, but really I meant here connections between ideas. So how do we take what we know in a methodology area or in aging and apply it to other work that we do or other programs, or think about other interactions between programs. And then of course, comfortable with collaboration. Almost all of the work that we do is collaborative. And then real quick, there are, in addition to working for our contractors, there are also opportunities to sort of try out aging research or aging policy roles. The Health and Aging Policy Fellowship, I know there's some folks from the Rick Marr Network that have already done those, and I've had the opportunity to work with them, which is great. The AAAS fellows are great. And then the ORISE Fellowship program, you can apply to it. And then federal agencies have sort of a quick way that they can hire or at least get fellows off of that ORISE Fellowship list. And then here is my contact information. Amanda, I'm sorry I went so long.
It's no problem. Does anybody have any questions for Helen that you haven't already put in the chat? Okay. Just FYI, Helen, I was kind of monitoring the chat while you were presenting. If you don't mind doing this, something similar, I would appreciate it. You're on mute, so I did, but I assume you said yes.
The answer is yes.
So, okay, I am from the Administration for Community Living. I worked with Helen and ASPE for 10 years, so I'm very familiar with the organization, and Helen has worked with ACL for 10 years, or for longer, for her entire stint in ASPE, and so she's very familiar with ACL. Let me just actually put the chat here, just in case. All right, so Helen mentioned that HHS encompasses a lot of different organizations you've heard of: CDC, FDA, NIH, CMS, all of the big ones, plus all of the small ones, like mine, the Administration for Community Living. And I will say I came to aging research differently than Helen. Helen, I think you and all of you are probably lucky in that you kind of knew what you wanted to do when you were growing up, maybe when you were younger. I was a little less focused, and I had an undergrad in political science. I did a master's in public health and health policy, and I realized then that I loved public health, but I love data even more. And I got into the weeds around the particular topic that I was interested in at the time was childhood obesity. And so I did a randomized school-based intervention to prevent childhood obesity and learned about randomized cluster designs. And I was like kind of really excited about how to do studies like that from that point on. And when I started in the federal government shortly after graduate school, because I also didn't think I wanted to be an academic, but I wanted to do research of some sort, and I was really interested in policy as well. I started as a fellow in the Health Resources and Services Administration, and they hired me to do program evaluations in disability and maternal and child health. And so I did that, and I learned all about federal data. I worked on the National Survey of Children's Health and analyzed that kind of data. And then the Obama administration came in, the first Obama administration came, and the Office of the Secretary at the time, ASPE, needed help working on childhood obesity issues. So I left HRSA, went to ASPE, stayed there for a decade, and loved it. It's why I stayed so long, and had 3 or 4 different jobs there. I was lead on the CDC portfolio. I was a senior advisor on evidence and evaluation. Then I ran a division that really looked at data policy, data coordination, evaluations, how we conduct them, how we can conduct them more rigorously. And I also detailed to the White House to do similar things. Then I left ASPE and went to CMS at the Innovation Center and worked at the Innovation Center for a little while. And now I'm here running the Performance and Evaluation Office at the Administration for Community Living. So someone asked in the chat, what is ACL? So let me tell you what we are. We're a small agency, but we really, our goal is to keep people aging in place and keep them independent at home, whether or not they have a disability or whether they are an elder adult. For us, we classify older adults as 60 or older. We really work to make sure that all people, regardless of age and disability, live with dignity, make their own choices, and participate fully in society. That's what our services and programs are meant to do. And I evaluate them, which I love. I will say the other thing I meant to say about me is that I was a caregiver for my grandmother with Alzheimer's, and now my mom is going through that. And so while I don't have experience in as much experience in research and aging, I have lived experience as a caregiver. And so Helen knows I've come to her over the years with many, many questions about how to access ACL services for my grandmother. And then when she went into long-term care, that was also a process. But anyway. So this is kind of what we do. We have lots of different kinds of programs at ACL, disability and aging programs. If you've ever heard of the area agencies on aging, those are a secondary organization that's funded through our state units on aging, through our grants. We also, the administrator for ACL serves as the advisor to the Secretary on Disability and Aging Policy. We've been called the conscience of HHS because we're always pushing and our administrator is always pushing disability status and aging as topics that need to be addressed as priority topics. We work with ASPE, we work with lots of other departments. I'm routinely talking with CDC, NIH, not as much with FDA, but the White House and other people around aging policy and disability policy. We've worked very closely with our Office of Civil Rights on developing the recent 1557 rules, as well as in other civil rights regulations. We work very closely with CMS, SAMHSA, the Substance Abuse and Mental Health Services Administration, and CDC. We work closely, like Helen, with HUD and VA and other places to really push the agenda of trying to do everything we can to ensure that policies and programs that the federal government are funding are ensuring that they're inclusive of people with disabilities and older adults who frankly face often similar issues. So we provide direct services. You've probably heard of the program Meals on Wheels. So we have our nutrition programs. Most people know our congregate and home delivered meals programs. Community services, caregiver supports. We have elder justice programs that are, the legal advocacy and rights protections, both for disability and for aging networks. Individual and systems state level advocacy, we do a lot of, especially our disability programs. We do research. We have a research arm just for disability. My office does intramural and policy research the same way that ASPE does for ACL programs and policies. We do have an information and referral and streamlining access to healthcare. If you've ever not looked at our elder locator program, you should, or our elder care locator website. I'm going to get it out. You should definitely take a look at that. And we do capacity building in many different ways. Happy to talk more about that later if you're interested. So what do these networks look like? We fund over 20,000 community-based organizations, and I'll show you kind of the way it works in a graphic in just a second, but aging networks usually goes to the state unit on aging and then goes down to the area agencies on aging, and then those, we call them AAAs. Those AAAs contract with service delivery providers to do things like deliver meals and, provide caregiving supports. Then we fund developmental disability networks. These are really sort of a constellation of programs that do exactly what we are, what's written here, protection and advocacy systems, the state developmental disability councils, and then the University Centers for Excellence in Developmental Disabilities. I'm a trainee of one of those USAID programs. And then they also fund into the independent living networks. So these are one of our larger disability programs that a lot of people take advantage of, provide a lot of services to people with disabilities. And then a lot of other ones, state no wrong door systems. You've probably heard of the Aging and Disability Resource Centers, traumatic brain injury programs, limb loss and paralysis resource. We fund the Christopher Reeve Foundation, and Christopher Reeve gives a lot of money to other grants or grantees for paralysis and paralysis research and services. So this is what it looks like for our aging network, which is more relevant to you. AOA, our administration on aging, is a part of ACL. You'll see that in just a second. We fund 56 state units, and that's actually outdated. I think we have 282 tribal grantees and 618 area agencies on aging, more than 15,000 service providers, so many volunteers. We have a huge volunteer network that provides services for us. And you can see kind of these are some of our performance measures that we have in terms of the meals, both congregate and home delivered, rides. We provide transportation services, personal care, homemaker and chore services, caregivers assisted. We do provide respite care, and then ombudsman. We fund the state ombudsman program for long-term care when people complain. So this is our budget. Helen didn't put ASPE's budget up. Ours is a lot bigger, but we have a very similar size organization in terms of the number of people, but a lot of our money goes out the door to fund these networks. So we have about 185 people, so still small in people. And then this is our organizational chart. And I'm here in the Center for Policy and Evaluation. So we have two offices, mine and then our policy office, which is there. And so you'll see here we have, the Administration on Aging, our Center for Innovation and Partnership, which does, they're working a lot on business acumen and trying to really focus on how we shore up our grantees to be able to contract with healthcare and delivery health systems in order to get paid for the services that they provide when people start screening and referring more to our programs. The Administration on Disabilities, and then this is our research arm for disability, the National Institute on Disability, Independent Living and Rehabilitation Research. And then we have regional offices. So we have people who are all across the US in our 10 HHS regions. So what do I do? What does my office do? It's very similar to what Helen does in ASPE. And in fact, I was so excited to come to ACL because I wanted to do what we do in ASPE, but on a smaller and more focused scale. And I get to do that. And I'm having a ton of fun doing it because I have so much flexibility, even though I have a really small budget myself. So we do all kinds of program evaluations. If you Google ACL HHS evaluation, you'll see our page. We manage performance and data collection, like we do performance management and data collection. We also do policy analysis and intramural research. And we also, through our evaluations, because we do all kinds and all different levels of rigor in terms of our evaluations, we develop evidence for program improvement and policy development for our networks. So what does a typical day look like in ACL? It's very similar to ASPE. We fund a lot of our evaluations, especially the larger ones, through contracts, but I'm also hiring more people to do intramural analyses. I just hired a statistician from Census, and she's one of the most creative analysts I've encountered in a long time. She's lovely and is looking at our national survey to try to figure out, hey, how do we can we do some cross-sectional analyses that look, our survey is cross-sectional. Can we actually do some repeated analyses to figure out, can we take a longitudinal look of our Older Americans Act participants, the way we've designed our survey? It seems like maybe we can, but she's still investigating. But it's kind of flexible in terms of what we do, but it is very similar in terms of we do a lot of analysis. We do a lot of work with our grantees. We work a lot with our programs, very closely with our programs. I call our nutrition program leads, I am on meetings with them 2 to 3 times a week, talking about how we need, what we need to evaluate, how we're evaluating it, and helping them with their research agenda. So same as Helen, I kind of wanted to just give a shout out to some of the things that we've done. We just finished up a really big evaluation on long-term care ombudsman program that should be, posted soon. We've done an evaluation of aging and disability resource centers. We do on an annual basis, we do our national survey of Older Americans Act participants. The Older Americans Act is the statute that governs the administration on aging and our aging network. Several other statutes govern our disability programs. But yeah, we do a lot of program evaluation, and we're transitioning right now from program evaluation. We're not going to stop doing program evaluation, but we're trying to look at how we actually purchase alternative data sources to do more, I think, innovative kinds of data analyses. So same thing with Helen. We do a lot of interagency work, interagency partnerships. We kind of, we're doing a lot right now on social determinants of health and health equity. I'm always looking at how we can improve our data sources, or actually look at purchasing other sources of data like Helen and every other part of the federal government. And like you too, if we want to access claims data, we have to buy them and they're so expensive. And so trying to figure out how we can get, look at other sources that may give us similar types of analytical ways to analyze the questions that we're trying to answer. So also, similar to Helen, who we're looking for very, intellectually curious, good soft skills as well as good technical skills. We really need somebody who wants to work in a fast-paced environment. Our things move kind of, even though we're the federal government, we kind of move pretty quickly on a lot of things. It's less academic in that way, but similar to academia in that you can drive a lot of your own work and drive a lot of your own analysis. But we also are looking, frankly, for people with lived experience, people who have disabilities, people from tribal communities, people who are, have any kind of lived experience that's relevant to ACL's programs. And that's pretty broad in scope. And one of the reasons why we do look for that is because we actually hire, I think at HHS, we have a pretty large proportion of people who work at ACL who have disabilities. So we really do look at lived experience when people are coming to work with and for us. So just wanted to make that note. And Helen didn't talk too much about the Presidential Management Fellow program, but we use PMFs a ton. We love them. They are, it's a way to actually have people, new graduates, either master's or doctoral level, go through the process of, becoming a PMF candidate, and then we hire them as fellows, and they get a lot of extra training. They're basically the sort of crop of, leaders that are coming in on an annual basis to HHS. And they have an easier hiring mechanism. The other thing Helen didn't really talk about is that we can do what are called IPAs. And IPA stands for Intergovernmental Professionals, and it's governed by it's the Intergovernmental Professions Act, I think it is. Helen, correct me if I'm wrong. Agreement. Yeah. Well, it's an agreement, but it's governed by, I think, the act. Okay. Yeah. But the IPAs, actually, you guys as assistant professors could come and do an exchange with ASPE and do research. We pay you. We can actually go to your academic institution and do research and learn from you. It's a really kind of flexible, interesting approach to cross-pollination of different kinds of professionals in different environments. But the PMFs are a way that we tend to hire a lot of folks. We also we hire right off of USA Jobs, which can be a nightmare for a lot of people, but it is a way that we get a lot of our people is by posting jobs on USA Jobs. Yeah, and I think I'm going to stop there because I went through that, I think, really fast to see if there are any questions about ACL or about what we do.
Thanks,
yes.
Annette. Can I just real quick add on USA Jobs? So if you're looking for a job with the federal government, you will have to apply through usajobs.com. But for a variety of structural, administrative, bureaucratic reasons, it is very difficult for us to get to well-qualified candidates through USA Jobs. It's a whole longer story, probably not fit for public dissemination. But if you're interested in, or you have folks at your organization or students who are interested in working at either of our organizations or anywhere in the federal government, I encourage you to reach out first and get in touch with us, because we can think through these various options and plan out what the best mechanism for federal hiring is. You might have heard that federal hiring is very, very, very challenging, and that is 100% true. And we could work with you directly on that.
Excellent. Thank you so much for your presentations. That was a lot of information in a short amount of time, but I think the information was clear and concise and definitely important for all of us to learn about. I think there are some questions in the chat. Feel free to continue posting those there, or raise your hand if you would like to ask our presenters a question. Yeah, Deanna.
Really great presentation by both of you. Thank you so much. Amanda, my question is for you. How did you like moving around in the agencies that you went through? I mean, academia is different, right? We just work so hard to get tenure, and then we get tenure, and then we maybe think about making a move, right? So we're in essence at an institution for a longer period of time, and multiple moves are less likely in academia. So how did you adjust to that? I find for me, even moving into a new office and a new institution always comes with a learning curve and all of that. So how did you adapt? What sort of advice? What did you not like about it? If you could maybe even share that.
Sure. I have lots of thoughts. I need to sort of think about what I'd like to share. I'll say that the pro to moving around is that I know I have such a large network because I've worked in so many places, and I think, like academia, my guess, because I haven't been in academia for so long, the federal government, and especially HHS, even though our organization has 90,000 people, it's still kind of a small world. And I've been in several places, as you saw, around HHS. And so every place I've been, although I stayed at ASPE the longest, I have really gotten to know both the culture and the context of each agency, and gotten to take, really many wonderful relationships with me. And I would, moving around to me has been a really great experience. I'll say having organizational history in a place is also really important. Like Helen has been in ASPE for years. She can tell you, both of us can tell you at least a lot of the history and why we have done things the way that we have, and kind of what we've tried and what's worked and what hasn't. When we have new political leadership come in all the time, it's sometimes really important to be able to provide that context. However, also having kind of a new perspective on things and how people do their work is also equally important. And I've seen that be really useful. So I think that's why the IPA process is really helpful too, to have kind of new perspectives come in that aren't sort of, rooted in government. We tend to do things, I was saying we're fast paced, but also things move really slowly, and our data, we have big lags, and it's really tough. And so I think having a well-rounded experience has been for me very helpful. The thing that's the hardest is honestly, every time I try to go to, or every time I do go to a new organization, it's a huge learning curve, and that's tough. You forget when you've been somewhere a long time, how much you know and how much you sort of don't, everything that's on autopilot, you forget how much time, effort, and energy it takes to get to the autopilot phase. So I'll stop there. I think, Helen, you were going to say something too.
Oh, I was just going to say, if you want to try something out, that Health and Aging Policy Fellowship is a really great opportunity. It used to be all residential, so you'd have to take a sabbatical year, and it's really targeted towards academics who are interested in learning about policy. So you'd have to take a sabbatical year, move to DC, sort of uproot your whole life and come to DC. They've really expanded their non-residential and part-time programs. So now I worked with Justina Avila-Guerrar from Columbia this year, and she would join me for meetings, and we focused on a particular project. And so it was about 1 day a week worth of work that she was able to sort of be part of our organization and participate in a variety of different policy things. So if you're interested in trying out something, you know, in that space, I would encourage you to apply to that program. I will talk, Amanda, there's a question about work-life balance. So I'll just say that one really nice thing is that while we do sometimes need to work after hours, it's not, there's not a general feeling of I need to work. The more that I work, the more benefit that I will have. So we don't usually have things hanging over our heads. Generally, you know, not like a grant application deadline, or, you know, if I write another paper, it's better for my career. For the most part, our work is between generally, and we're flexible on this, you know, 9 to 5 or 9 to 6. There are times during the year where we need to work to get the work done, but it's a really nice, from that perspective, work-life balance. I mentioned I have, or I didn't mention before we started, I mentioned I have 4 kids, and I was able to manage 4 kids and commute into DC every day before the pandemic. And so, and while 4 kids is kind of an anomaly, I'm actually not the only woman in ASPE who has 4 kids. So we are extremely supportive, I think, as an organization of work-life balance. Our nominee for assistant secretary is out on maternity leave now. And so it's, I think when I started, Amanda will remember this, when Emily was pregnant, there were only 2 women. I'm sorry, she was going to be the only woman in ASPE with more than 1 child, which is so hard to believe. And now it's become a much more family-friendly organization, and a lot of flexibility with the pandemic. Although we do still go to the office 1 day a week, and we do not currently allow fully remote work. Amanda, do you want to talk about work-life balance at ACL? I mean, it's very, very similar.
Yeah, it's very similar. The only thing I will say is that we have more of a focus on accessibility at ACL. And so I think I mentioned that we have a pretty high proportion of people who have disabilities, both physical and cognitive, that work at ACL. So our big push is to make sure that we have interpreters for people who are hearing impaired, that everything is 508 compliant, and that we have wider hallways, and that we have, you know, when people do come into the office. And so while we don't have 100% telework, we are only going in, I think, one day a week right now. But it's the same as Helen's. Like federal jobs, typically we don't have to work after hours. I have been, because I've been building an office, but I'm also, I love what I do, so it's not hard for me. I also don't have 4 kids, so it's easier for me to work at it during the evenings. I've always been in awe of Helen and her ability to sort of create really strong boundaries around her work day. But yeah, I also put a link in the chat to the Federal Resume Guidebook. You can buy it on Amazon. You can buy it in other places. That Federal Resume Guidebook has gotten many people, I think, at least to make the certifications on the USA Jobs site. And so I think, yeah, Helen, do you want to provide info on the health policy management? But that guidebook is super helpful if you're trying to understand how to do your federal resume. More is always more with a federal resume. They like, if you're building a resume, if you want to apply for a job, then that is really, really very helpful for you. The PMF would be for students because it's for new students, I think within 5 years of graduating from their program. You guys would be more, I think, attuned to the health and aging policy, health and aging policy, or IPAs or something like that, or just applying for jobs.
And it's important to remember when you're applying, you know, and writing your resume and looking at job postings, which of course we could talk to you about, is that like, they're often being evaluated by people who don't have knowledge in our topic areas. So you might write gerontology and the posting says aging, and the people reviewing it don't know that they're synonyms. So, you know, there's tricks like that. What else? You should always apply lower than you think you're eligible for in terms of earning potential, et cetera, because it's, easier, always say you're the best at everything. I mean, there's a lot of, tricks like that, but it's often, some of these barriers are insurmountable, and sometimes our staff have to apply on USA Jobs for a promotion. So there's the GSA, the GS scale, and those GS positions, you might be in a GS 12 position, and we want to promote you to a GS 13. You would have to apply to a GS 13 program, and it's so challenging that sometimes people are applying to literally their position and they get screened out. So really happy to work closely with people. So GS level, so I started with just a graduate degree. So and no work experience. Oh, the other thing is that work experience counts the same as education for the federal government. So you don't have a sort of a benefit of having a PhD over a master's degree. So I started as a GS 11 with straight out of graduate school. And I actually started my first year as a contractor, and then had to apply for my job, which my office wrote very specific, like you need to have worked on these 3 topics that I had done work on.
Well, we are at time, and clearly we probably have some unanswered questions, but that's okay. I really would like to thank everyone for being with us today. Dr. Cash, Dr. Lamont, thank you so much for your willingness to speak to our group. If it's okay with you, I'm going to ask that you share your slides with us, and we will post them in addition to the webinar on our RICMAR Coordinating Center website. And I welcome all of the participants today to get in touch with them directly if you have any additional specific questions, either about their offices or their work or positions that you see. And, we may just have to invite you back to speak to a different group of RICMAR scientists at some point. Sounds like this was a great topic.
Thank you so much for having us and coordinating this. We are happy to chat anytime. Our information's on the internet. I mean, you'll send it out, but if at any point you have questions about the work we do, or if you want us to know about something you've done or a publication, we try to keep tabs on what's happening, but we welcome, any contact you all want to have with us.
Absolutely. Thank you.
Thank you, everyone. Have a great day.